Thank you, Mr. Chairman. This has been an excellent hearing and a great panel. It seems to me that thousands of Americans are losing their jobs at the precise time when thousands of new health care providers are needed. And sensible health workforce policies then provide multiple benefits. You've got Americans getting good-paying jobs in their communities, jobs that cannot be outsourced, while at the same time patients and the healthcare system benefit from having fresh healthcare provider talent and advocates. So I want to start with some issues relating to the workforce question. I was interested in your comments, Dr. Wortman, because it really goes to something that has really concerned me greatly as I've gotten into this issue. And for example, under the Workforce Investment Act, the government spends close to $4 billion, and it's not possible to see what is going in clearly to the health professions. For example, we'd like to know what's going into training nurses and nurses' aides in areas where there's a consensus more talent is needed. I gather that you're very troubled about the fact that some of this money is not spent very efficiently, and that's why you'd like someone to serve as a coordinator to try to gather exactly what is being done with the federal dollars today.
Well, I'm a big vision person, and I think that we need to have a much better overall vision and perspective on the whole picture and what's going on. What are the inputs? What are the outputs in terms that everyone can understand in a very transparent sort of way? So, yes, I would agree.
Now, Dr. Goodman, you all at Dartmouth have been doing very good work, and I was interested in your idea of competition for GME funding. Now, before a big brawl breaks out over that one, let me ask you, if I might, would there be a way to ensure that that could be structured so that everybody would have a fair chance to be part of it? Because I think, for example, what you all have done at Dartmouth is to show the tremendous value of shared patient decision-making. And that ought to be one of the things that's taught and emphasized. It's clear Jack Winberg, for example, has drilled that point home. We ought to be promoting it. How would you structure the competition so as to have schools promoting that sort of approach in their applications for GME funding, and it was done fairly?
Thank you. I will try to be brief. And I use the example of the NIH because I really feel that that is a model in that one can set programmatic aims. And then NIH funding is free and fair funding. I mean, there is no favor, really. It's a great model. Right now, GME is fossilized. Those who have had great training programs in the past, or at least large training programs, forevermore will receive funding for those programs. There's very little incentive for innovation. There's very little ability in terms of the government to be able to influence the specifics of training, like incorporating shared decision-making or a notion of population health or any other curriculum innovation. This would also allow for places that traditionally have not had large GME training programs, places like Utah or Montana, to begin to expand their training programs without the assumption that places that have always done it should always do it just because they have done it.
We'd like to follow up with you on that. Let me see if I can get you, Dr. Mullen, on one last point. I think it's well understood that there's tremendous promise with what a lot of people call the medical home. I like to call it the healthcare home because I think we ought to be saying that in a lot of instances, individuals other than physicians ought to be the medical team leader. So if you take the proposition, Chairman Baucus has focused on it in the white paper, a lot of senators are interested in this. Who do you think would be the best, where do you think would be the best place at the federal level to say this is where we ought to lead the effort to train people to head a healthcare home or be the medical team leader? Would Medicare be the best place to do this, or what would be the appropriate place at the federal level to lead that effort to get the medical team leaders?
A good question, Senator Wyden. The Medicare has had the leading role, de facto role, in health workforce policy because of the enormous impact of Medicare GME, but it's been a role that has not been an active one in the sense of having either the mandate or the capacity to do analytic work or projections, or then to move the money around, as Dr. Goodman has suggested. The Bureau of Health Professions and HRSA has had a more cerebral role, but no money or mandate to move out in an aggressive way in this regard. So I think you need a reorganization or a separate unit set up within the government. I think funding traditionally for workforce programs has come through Title VII to HRSA, which is a different authority, a different jurisdiction, which, while we're on the topic, is I'm delighted this hearing is as broad as it is. For those of us working in the field, the jurisdictional issues between finance and health, for instance, have prevented a big picture look at issues like...
Well, not this year.
Yeah, well,
Not this year.
this is wonderful for those of us who have been here. So, in answer to the question, I think you put your finger on a real problem in an area for growth in public policy. Right now, the agencies in HHS, neither one has all of the abilities to do it. And between them, that is HRSA and CMS, there needs to be responsibility for this, and that could be a joint effort or lodged in either one with correct authority.
Thank you, Mr. Chairman.
Thank you. I'm going to interrupt our proceedings right here. We have a quorum present to report out the nomination of Mr. Kirk to be the STR representative. Quorum is now present, and I thank my colleagues for adjusting their schedules so we now do have a quorum. So the business before the committee, and I might tell our witnesses this will be very brief. The business before the committee is the nomination of Ronald Kirk to be United States Trade Representative, and I'll now entertain a motion to report the nomination.
No, so moved, yes.
Is there any debate? If there's no further debate, the committee will vote on the motion to report the nomination. Those in favor say aye. Aye. Those opposed, no. The ayes have it, and the nomination is ordered reported.
Mr. Chairman, I have an absentee that wanted to be recorded as a no vote, and that's Senator Bunning. So would you have the record show that?
Yes, sir.
Yeah.
You got the clerks so noted.